Okay. That was a delivery person at the door. Okay, so when I'm doing her lungs, I am first going to check for equal expansion, and I'm going to do that by putting my hands down and having her take a deep breath in and out, and my fingers moved equally with exhalation and inhalation. So now I'm going to check for fremitus, and I'm going to have the patient say 99. 99. Do it again. 99. Uh-huh. 99. Uh-huh. 99. Uh-huh. 99. Uh-huh. 99. 99. Okay. And what we're checking for is if there's any air in the tissue, which could mean like emphysema. So now I'm going to percuss, and I'm listening for, I'm going to also get the excursion expansion, which should be in the normal adult 3 to 5 centimeters. And we'll go ahead and got my pen here to make my mark. So, okay, go ahead and take a deep breath in and hold it. Stop. Go ahead and breathe. Okay. Now I want you to get a couple breaths, and then I want you to exhale and hold that. Okay, you can breathe. Okay, and I got my tape measure. We're just gonna measure from one mark to the next, and hers is 4 centimeters. And I would do the same thing to the other side. Also, what I did before I even started was I observed her back. Her skin, she has several moles, which none of them are having regular borders, or are black or crusty. So that all looks good. So now, since I have checked the fremitus, I have percussed, now I'm going to listen. Deep breath in and out. If you need to rest, let me know. Last one. Okay. Her lungs are all clear on inspiration, exhalation. Put my stuff away. Now, move back here to the front. Since patient does not want to disrobe in front of the camera, I would actually be checking for the fremitus on the front side also by having the patient say 99 or blue moon, whatever words kind of emit vibrations. I would check her, all 5 of her heart sounds. I would check her apical pulse. I would palpate it, and then I would also listen for a minute. I would check for equal expansion, and I think I can go ahead and hear maybe a couple of the heart sounds up top without her having to disrobe, so I'll go ahead and do that. Oh, breath in and out. So I was just checking her anterior lung sounds also while I was here. Okay. You can breathe normal. And this is probably the last one I can get to. Okay, so I've heard S1 and S2 and I don't hear any murmurs. Now I have to listen with the bell. Okay. Okay, that sounds good as well. The bell is for more of the high-pitched sounds that you can hear. I didn't hear any whooshing noises, no other adventation sounds. Also on her lungs, they were clear, no wheezing, rhonchi, crackles, none of that was noted. So now we're going to move on to the abdominal assessment. And I'm going to assist the patient. Hold on. Are you comfy? Okay. Is that okay? Is that okay? Mm-hmm. The patient, she is a heart failure patient, so she does have a hard time with laying flat. When in the hospital, you know, any nurse will come across this. Some patients, you just cannot lay flat. So I have the patient elevated up on about 3 pillows, which I think is even still low for her, so we're going to do this kind of quickly. Okay, so the first thing I'm going to do is just kind of come up to her tummy. Not going to show any body part. Okay, that's good enough. Where's your... Okay. Okay, so the first thing I'm going to do, I'm just observing. She does have a few bruises noted. She's got a few moles. Again, no irregular borders. She has some, it looks like a few skin tears over here. Okay, so now I'm going to go ahead and listen before I percuss. And if no bowel sounds are heard, you have to listen up to 5 minutes in each quadrant. So I'm going to start in the right lower. Okay. So her bowel sounds aren't hypoactive and they're not hyperactive. They are normal. So now I'm going to go ahead and do a light palpation. And I'm feeling for any masses, nodules, and you know, tell me if you're in any pain. Any pain with that?
No.
Okay. So now I'm going to go into a deeper palpation. Any pain?
No.
And I'm not feeling any hardness or masses or anything. So now I'm going to go ahead and try to palpate for her liver. I can feel her rib cage right here. So I'm going to just kind of put your, can you put your arm up? Is that comfy? Just for a minute? Okay. So I'm going to put my one hand under here, and I'm going to have the patient take a deep breath in and out. And I can't palpate the liver, which is okay. Now I'm going to go ahead and try to feel for the spleen. So again, deep breath in and out. Again, I cannot feel it. So now I'm going to go ahead and try to pinch the kidneys between my hands. Any pain with this?
Mm-mm.
Any pain with that?
No.
Okay. Okay. So that's all of that. I'm going to have the patient sit back up. Okay. And one thing I did forget to do was to check her trachea, that it was midline. And go ahead and swallow for me. Okay. And I'm going to check for her thyroid by going behind her and feeling for the knot. Okay, go ahead and swallow. Okay. Swallow. And the trachea does move up, and I can't palpate the thyroid gland. So now we're going to move on to muscle strength. So I'm going to have the patient, I want you to grab my fingers and squeeze. Okay, good. She's good strength. Go ahead and stick your arms out like this. I want you to push against me. Okay, good. Nope. Keep them up. Keep them up. Push against me. No. Resist me. There you go. Okay, now push out. There you go. Okay, so she's a little slow, but she's strong. Okay, now I'm moving on to her legs. And again, the first thing I'm going to do is observe. I'm looking for any edema, or if there's any, if I notice any swelling. Looking for any scars, any nodules, any masses on her legs, and they all feel fine. Her skin temperature is the same on each leg, so no temp difference. So now I'm going to check the strength of her legs, so I want you to push out. Good. Now pull in. Good. Now push down like you're on a driving pedal, and then pull up. Good. So her leg strength is good. Now I'm going to go ahead and check her pulses. So I'm going to check her popliteal pulse. Okay. Her posttibial. Okay. And then her dorsalis pedis. Okay. And the next foot, dorsalis pedis, posttibial, and popliteal. Okay, they're all palpable, which means her circulatory system is working. She's getting blood down all the way to her feet. So now I'm going to go ahead and go into checking the reflexes. So let me get my... Okay. And I did not check her brachial pulse up here before when I checked her radial, so I'll go ahead and do that now. Okay. So now I'm going to go ahead and check her reflex. This is her bicep. Do you have your hand relaxed? Just turn it. There you go. Okay. Now her tricep. Just hang your arm here. let it dangle. I got your thumb. Let your arm relax. There you go. Let it relax. Okay. Same arm. Relax. Let your shoulder drop. Okay. There we go. Oh. Put your hand, there you go. Just relax it on your leg. Relax. Okay. Now I'm going to check. It's really fun. Just let your feet dangle. Okay. And the Achilles reflex. Oh, almost fell. Okay. And also, so that was all of her reflexes. Okay, so I'm also going to check the cap refill in her toes. And it's brisk, it's less than 3 seconds. And I would also note if there's any wounds on the bottom of her feet. For the aging adult, it might be hard for them to be able to do a total skin assessment every day. And not that you're at this age yet, but their mobility has decreased, so they're sitting around more. So you're having to educate the patient on position changes throughout the day, and to also assess their skin for any breakdown on the backside, on any pressure points like the heels, the back of the shoulders, the elbows, the sacrum, hips, and let me put my thing away. On a female, you would also do a breast exam, which, you know, patient does not want to disrobe for that, so I'll just talk about it. I would make sure to educate my patient to do monthly self-breast exams while in the shower, which is the easiest way to do it because you're already disrobed. And at her age, at the age of 40, all women should go in for yearly mammograms, and I know that my mom is up to date on them because she has had several biopsies to hers. Just no cancer, they were always benign. And I think that might be it. I also want to note on the last thing that when I did have the patient lay down, stand up, walk over to the Snellen eye chart, I was watching her gait and there was no abnormality with her gait. But I will do one last thing if I can have you stand up, and I want you to face the camera in front of me. Don't trip. Here, get right in front of me. I'm going to check her spine for any curvature, so I want you to bend down in front of me. Okay, so I'm looking at her spine to make sure it's in a nice long line and that there's no scoliosis, kyphosis. You can stand up. And now I want you to lean back as far as you can. Okay, good, straight. Now, I want to check her range of motion of her neck. So I want this ear to come to this shoulder. Okay, and now this ear. And now look down, look up, look over here to the left, and look over to the right. Okay, now I'm going to go ahead and sit back up one last time. I want you to push away. Take your glasses off. I want you to push away. Good. Good. Push. There you go. Good. Good. And back. Good. So she has good strength in her neck still. She does have the decreased range of motion, as you could see when she tried to put her ear to her shoulder when she was looking to her sides, but that again is because of the ACDF that she had to her neck due to a herniated disc. This completes the portion of my head-to-toe assessment. Sorry my cat jumped in and got into the scene. Thank you.